was 4 years old, my big sister was the coolest person I knew. At 13 years old, she had it all, from her platform flip-flops to her chokers and the Gap sweatshirts. I never thought twice about the big fixer on her leg. It wasn't until years later that the word hemihypertrophy that had frequented my childhood really meant something to me. Hemihypertrophy. It sounds kind of scary. Well, I guess maybe not to you, but to 4-year-old Betsy, it was really freaky. I'm going to break it down for you by discussing how this disorder occurs, all of the types of treatments for it, and then diving back into my own story. Hopefully, for you guys who are pursuing a career in medicine, this will kind of pique your interest. If not, you can at least look at some kind of gross, kind of cool pictures while I talk through the different treatments. According to St. Louis Children's Hospital, hemihypertrophy is also referred to as hemihyperplasia. It's a genetic disorder that is characterized by the overgrowth of one half or one hemisphere of the body. And it's kind of relative, it's one half compared to the other side, but there must be a big enough or significant enough difference for you to actually be characterized as hemihypertrophy. It can be isolated to one part of the body, so as you can see, this baby has just one leg that's longer than the other, but sometimes it's an entire half of the body. It may not present itself into childhood or adolescence, but sometimes, like with this girl, it happens in infants. So some of the symptoms, like I said before, are overgrowth of one half of the body, it's uneven leg length, uneven arm length as well. It can be enlarged tongue or abdominal organs, and you have an increased likelihood of getting certain kinds of childhood cancers as well. Some of the other causes of hemihypertrophy, according to the Children's Hospital of Philadelphia, in most cases it is a brand new genetic disorder. It's not usually passed down from parents. It's also not from a mutagen that would have happened when you were in utero. Most of the time it is just a specific gene mutation. Most kids aren't the first people in their family to have it, but sometimes it can be passed down from parents. Usually the gene that decreases growth are turned off so your body keeps growing, or the genes that increase growth never stop, so that way, again, you just keep growing and they're too numerous. There are different ways to diagnose it. So one of those is the visibility. Obviously you can see a visible difference in the lengths of the body. Sometimes, especially if it's in your legs, it can be like pain in your lower back. You can also do genetic testing through a different kind of blood test. There are ways to treat hemihypertrophy. So according to healthline.com, it is specific to each individual, but there's no like true cure. You just kind of treat the outcome of the different growths. So depending on the severity in the area of the body, it can be left untreated as well. It just kind of depends on how much it affects your daily life and your overall health. So a lot of times it's coupled with tumors. So what doctors will do is screen for the tumors and then remove tumors as needed. You can also have corrective shoes, like you can see in this picture. It'll have a lift, so that way if, for instance, your legs are uneven, it will balance you out. There's also orthopedic treatment. So if it's caught early enough, you can place a stunt growth plate in the limb that stops the growth and lets the other limb catch up to the length that it is. There's also other kinds of surgery, like an Elizaroth fixer, which this information is from McMaster Children's Hospital. It's used to lengthen the bone. So as you can see here, the bone would actually be split in the middle. There would be a motor placed at the top with screws all through the bone, and the bone will actually be lengthened through that break in the bone, and it will, the motors will turn and pull the bone further apart, increasing the length in the bone about 1 millimeter per day. That's just one way that you can fix it. So kind of back to my story. My sister Maggie was diagnosed with hemihypertrophy at age 13. When she was diagnosed, her right knee was almost 1.5 inches taller than her other. So on this you can see the fixture as they were talking about before. For me, I really remember our weekly, sometimes even more frequently, visits to the doctor. Being only 4, I kind of got dragged along a lot. So I remember riding into Minneapolis, listening to Wicked or to Rent or to John Mayer in the car. I remember all of the really nice doctors and nurses that we met as well, particularly Dr. Dahl. I remember on this particular doctor's visit, he let me and my siblings tighten some of the screws on my sister's fixator, which really freaked her out, but for us it was really fun, and it was a way to like get us engaged without being like too freaked out in the whole process. I remember my sister, after getting her fixator off, was on crutches for a while, which made me super jealous because I thought they were so cool. We also got some really nice perks, like we got to meet some of the Twins players and Timberwolves players. We got to get in the front of lines when we were at amusement parks and stuff like that. And we actually got to watch the fireworks on 4th of July on top of the hospital, which was really cool. Like I said, in March, she got her fixator off and then she had a cast, but now she's totally fine. In college, she was a track athlete. She's actually in the Army now. She's a captain, so that's gone really well for her as well. She ran a marathon a couple years ago. Really the only thing that has affected her since then is she did have a hip surgery that was due to being on crutches so long it messed up her opposite hip. Thankfully, at this point, all of you would know whether or not you have hemorrhagic hypertrophy, so I think it's safe to say that you're all good. For those of you who are pursuing a career in the medical field, I hope you enjoyed my sister's story, hearing about the causes and effects of hemorrhagic hypertrophy, and hearing some of the different treatments. Some genetic disorders are incredibly interesting, and you'd be surprised with what you can find out. I never really knew much about hemorrhagic hypertrophy, but this was super interesting for me to do some research on and figure out. So I encourage everyone to do more research about hemorrhagic hypertrophy or other genetic disorders that might be in your family or that just interest you.